Assalamu alaikum, and you are now tuning to Shakil and Company on America's Islamic Radio. I am your host, Kevin Shakil, and today's exciting interview is sponsored by BMC, Best Medical Care, Darbars, Halal G's, Tech Bites, Roman's Barbershop, Kebab G's, Issue Realtor, Freedom Line Broker, and Elements Dental. Today we have none other than someone who is very, very dear to us here at American Islamic Radio. They're part of the American Islamic Radio family. They're our official sponsors. Today we have none other than Dr. Mushahid Faruqi. Assalamu alaikum, Dr. Faruqi. How are you?
Wa alaikum assalam, Shakil. Kevin, I'm fine, alhamdulillah. How are you?
I am doing well. How's everything going for you?
So far, alhamdulillah, everything good. Thanks to Allah. Everything good, mashallah.
Listen, Dr. Faruqi, I knew, you're one of those doctors who actually contracted COVID, survived it, and you're back.
Yes. Yes, you're right, exactly. That was very tough time. But with the prayers of all the loved ones and by the grace of Allah, mercy of Allah Ta'ala, I'm back. Alhamdulillah.
Amazing. Alhamdulillah. Thank God you're well. You're looking great. You're looking beautiful. You're looking better than ever, like they say.
Thank you. MashaAllah. Yes, that's all mercy of Allah Ta'ala.
Alhamdulillah. So the reason we invited you here today, right, is obviously COVID is back on the rise here in New York.
Exactly.
I believe we're back to the second wave.
Yes.
CDC just said that, quarantine from 14 days to 10 days, they reduced the days. So we have a lot to talk to you guys here today. So for all of our viewers who are now tuning in, you're tuning into Shakil and Company on American Islamic Radio. We have none other than Dr. Mushahid Faruqi from Best Medical Care here today to relay some information for you guys to know. So Dr. Faruqi, obviously cases are going back up, right? People are worried. People who are watching this say, okay, COVID is back. What do we do?
So as we know, same thing that we've been learning since it started. Precautions are out there. Everyone knows now what to do. And they have knowledge, just have to implement it. And basic things are basics and simple. Mask, first of all, keep the mask on while you're outside, while you're shopping, while you grocery store. Anywhere you go, keep the mask on and try to keep yourself distant from other person, the person that you don't know. No matter if he looks sick or not, because we know this virus can spread by people who they're not feeling sick. So keep the mask on, and then of course keep your hands clean. So hand sanitizer or washing your hands as is possible. But the handy thing is mask and hand sanitizer in your pocket, in your purse. So as soon as you touch something, you come out, you use hand sanitizer and keep the mask on. So those are the basic things that if we follow, we can prevent ourselves from getting infection and prevent our loved ones from getting this deadly virus.
So basically the way to combat this virus right now is to ensure that we're continuing to wear a mask, that regardless of what happens, if you're outside and you cannot socially distance, you have to wear a mask, correct?
Exactly. Yeah, I agree. Yes, that should be everyone's goal, everyone's effort to keep the mask on and advise other people too. Unless they don't want to listen, but still mask is very important. And of course, hand sanitizer, you're not touching your eyes and nose, those kind of all the precautions that we know.
Amazing. Dr. Mushahid, also, there's a lot of news that's going out there, right, in the community right now, saying that even if you don't feel any symptoms, go get tested. So a person like me, who's going to work on a constant basis, I'm not really surrounded around people, but obviously I have encounters, here and there, right?
Yes.
How often should I go get tested?
So it depending on every 2 weeks is recommending now, because the 2-week period is the one that where if you have coronavirus, you may show symptoms in 2 weeks, you may not show symptoms, coronavirus may come and go. So every 2 weeks, if they're recommending to get the test done. Doesn't matter where you're working, where you're going, but people who are outside working with some people in the office setting, especially healthcare personnel, they are getting every 2 weeks. So, for example, in our urgent care, City Health Urgent Care, that's we have one urgent care in Kew Gardens where we're doing testing.
Mm-hmm.
There's a lot of employee coming every 2 weeks. Their employer asking them to get tested every 2 weeks. So that should be people should do it every 2 weeks if they can.
So, Dr. Mashahid, let's say you have somebody who's watching this interview right now who's an employer, right, and wants to get their employees tested, right? How could they reach out to you to set that up?
So there is a website we have, www.cityhealthpc.com. That's one way to do it. Or I can share my email with you. You could post it in the email. Should I say it right now or later on?
Please share it with us.
So it's mushahid.faruqi at carezonellc.com. Mushahid.faruqi, that's my first name and last name.
As you can see, it's displayed on the bottom right now.
At carezonellc.com. Yes, so you can email me and then I will contact you regarding testing. But it's simple. Our urgent care located in Kew Gardens, 85-15 126th Street, Kew Gardens, and the name is City Health Urgent Care. Walk-in available. Like you don't have to make an appointment. Anyone who want to get tested, they can just come, ask for the coronavirus testing, and we do it.
Dr. Mashahid, let's say somebody who's watching this does not have health insurance, right? How does that work for them?
For specifically for only COVID-19 test is basically free. Some administration fee like urgent care fees is applied, but people who don't have insurance and they're not eligible for insurance, they will sign a waiver form. They will sign a form that they're saying, okay, they cannot get insurance and they can get the test done. The minimum amount usually is $50 to $75, but that's not for the test. Test is free. Only for uninsured patients.
That's great news. So, Dr. Mashahid, what is that address one more time for the urgent care?
Is 85-15 126th Street, Kew Gardens, New York 11415. City Health Urgent Care.
So for all of those who are watching right now, they want to go get tested and they're in the Kew Gardens area, you can go visit Dr. Mashahid's urgent care to go get tested. Also, Dr. Mashahid is also a regular family doctor as well. Isn't that correct?
Yes.
So, Dr. Mashahid, I have a question for you. And we had this conversation over dinner one day, right?
Yes, you're right.
You told me that a family doctor and a regular medical doctor is two different things.
Yes, in a sense, regular, you could say I'm a family medicine physician and I'm urgent care specialist. A family medicine physician is the one who can see babies, young kids, adolescents, adults, old people, geriatric people, everything. So that's the family medicine. An internist is the one who can see 18 and above. So for me, you can bring your kids to me. You could come to by yourself, family, all family can come to one doctor and one system. So it will be easy for anything that we need to do later on. So easy to go to one doctor, one PCP. So the care is more better.
I agree with that 100%. For all of our viewers who are watching right now, you are tuning into Shakil and Company on America's Islamic Radio. We have here Dr. Mashahid Faruqi, who was talking about his practices, talking a little bit about COVID and how we should get tested every 2 weeks, how we should continue to wear our mask, and how we should continue to have hand sanitizer and wash our hands. Dr. Mashahid, I want to touch a little bit on the importance of actually having a PCP, right? Because listen, people my age who are in their 20s and millennials, right? When we don't really get sick often, right? And when we do get sick, we just go to urgent care, right?
Yes.
Why should I have a PCP opposed to just continue going to urgent care?
PCP, to have a PCP is a good thing in a sense of course, one doctor knows you.
Sorry. For all of our viewers, Dr. Mashahid, what does PCP actually mean?
Oh, PCP, sorry. So PCP is primary care physician. So primary care physician is usually known as PCP. So everyone should select PCP. Most of the insurance require you to select PCP, but if you have PPO, private plan, then you don't need to. But it's better to have one doctor, so he will know your history, your medical history, your allergy history, and he can pull up your chart. And if you need anything in regard of referrals or any other tests, you should go through the PCP. And that's what all the insurance telling their customers or patients to select the PCP. So the care is more better, more easier, and more smooth.
It's basically having one dedicated doctor for all of your needs. That God forbid
Yes,
something happens to you, you have one person you can reach out to, opposed to seeing multiple different doctors every time you go to urgent care.
exactly. And with me, as you know, I usually people have my personal cell phone too. If they have any trouble or they need anything, and they can ask me, they can call me, text me, and I usually respond, and it will make it easier to take care of them. So that's what I do.
So to all of our viewers right now, Dr. Mashahid is actually my doctor. And whenever
Oh,
I need something, I actually call him right away. And he picks up and he goes, "What's up, Kevin? How can I help you?" And I'm like, "Doctor, I'm feeling like this, I don't want to go out. I don't want to risk myself for COVID." And he goes, "Hey, this is a symptom. This is what's going on. Let's do a telemedicine visit and we'll take care of you." So
yes, exactly.
one of those doctors who, I actually have his cell phone number, and I'm pretty sure that if you become his patient, you'll have it too.
Yes.
So Dr.
One more thing, sorry, one more thing I want to add. As you know, regarding COVID-19, and we discovered the mask. People know now if you're listening the news or watch and doing and following up the COVID-19 updates. So this is the first time it happened. Like COVID-19 has become one of the deadliest, one of the most common cause of death in the United States now. So it left behind the heart disease, cancer, and other things. And also, as we know, the 2,000 daily deaths is reporting this week. Also, there's more than 500,000 death may, God forbid, by March 2021. So everyone should be very, very careful. And don't ignore the mask and don't ignore the precautions. Later on, we can discuss more, but this is I just want to add this in your previous mask-related comment.
Thank you, Dr. Mashahid. As a COVID survivor, right?
Hmm. Yes.
What was the experience like while you were sick?
Experience was, first of all, you were lonely and very depressed in the hospital bed because no visitors can come and visit. But thank God to technology, I was able to do video chat with my family members, with my family, but clinically or medically, it was very hard when you cannot breathe and when you cannot go few steps to the bathroom because you're tired and you're out of breath. So it was very, very hard, very, very tough experience. And no one should get COVID-19. And people is still dying, as we know. The data is showing when they get it, lots of people dying, no matter young or old. So that was very, very hard, tough experience. But Alhamdulillah, I got second life and I'm back. And I'm telling everyone, okay, please be careful, keep the mask on, keep your hands clean. And when the vaccine comes, should get it. And it should be safe for everyone.
For sure. Dr. Mashahid, you have locations all across Nassau and South and Queens, right? Can you please tell us how many clinics you have in Nassau and how many in Queens?
So Best Medical Care is a small private practice. We have one in Nassau in Hicksville, one clinic, which is our newest addition. We have more in Queens. We are 4 or 5 in Queens, like Kew Garden, Richmond Hill, Fresh Meadow, Flushing, and Jackson Heights, and one in Brooklyn. And we have one specialty clinic in Richmond Hills. So around 8 clinics we have. Yes.
Mashahid, when do you see your family?
So I'm not the only one working, of course. So is my older sister, Dr. Batul Hosseini. Of course, she's also very well known in the community. She and we have other 6 doctors, 3 pediatricians, 2 internists, and 2 family medicine. So everyone rotate to different clinics. So alhamdulillah, it works out. We do few hours there and here and there, and it's good.
Amazing, Dr. Mashahid. If somebody wants to make an appointment to come to your Hicksville clinic, what is the phone number and how can they make an appointment?
So the general phone number is 718-850-1673. Number
One more
again,
time.
yes, 718-850-1673. And then operator will pick up. So they can just ask, okay, we want to make an appointment to Hicksville Clinic. Any doctor available, they can make it. If they want to make it with me, they can schedule an appointment with Dr. Mushahid Faruqi. And it's easy. If something like if you know someone or they want to contact through you, that can be done too.
No, I'd rather them contact you directly.
Okay, no problem.
So you guys have been tuned to Shakil and Company on American Islamic Radio. We had a wonderful conversation with Dr. Mushahid Faruqi from Best Medical Care. Listen, COVID-19 is surging again. We're hitting the second wave once more in New York. Please, please, please be careful. Continue wearing your mask. Continue socially distancing. Continue using hand sanitizers to wipe your hands and continue washing your hands. We might get sick and we might survive it. And we might bring this virus home to our kids and our family, but maybe they won't survive it. So it's up to us, those who are going outside into the world, to ensure that we take the proper precautions, that we ensure that we're trying to be as safe as possible, not to get this deadly virus. Because listen, the vaccine's almost out. We need to ensure that we take the proper precautions and be safe, because I do not want to see another janaza happening for COVID-19 in our community. This is your brother Kevin Shakil from American Islamic Radio. Assalamu alaikum wa rahmatullahi wa barakatuh.